Welcome to the Simulation for Healthcare channel. I'm Jo, your host. This is the third video in the series, where this time I'm joined by Rob Greenhalgh, who is an ED and HEMS doctor and a pre-hospital care lecturer. For me, in simulation, debriefing is the most important part. And in this video, Rob shares with us the importance of debriefing, particularly in his role as a HEMS medic. If you have any questions, or you would like to suggest something you want to see in the future, leave a comment below. If you enjoyed watching, then please like, share and subscribe to my channel. Thank you. Good morning, my name's Jo Lawrence and I'm a senior lecturer at Brighton Sussex Medical School, and I also have a specific interest in debriefing in healthcare. With me today, I'm delighted to have Rob Greenhalgh. Rob is an emergency medicine and air ambulance doctor and is also an honorary lecturer in pre-hospital care at the Institute of Pre-Hospital Care London. Good morning, Rob.
Good morning, Jo. Thanks for inviting me.
Rob, you spent some time over the past year working in pre-hospital care in London, and I wonder if you would just share with us how important was debriefing for you during that time?
Yeah, so it's probably worth giving a little bit of context to me. So I've worked in emergency departments and I've worked in pre-hospital settings for a number of years, but most recently working in central London, responding to the most critically injured and sick patients there are. I do that alongside the ambulance service, and debriefing is a really key part of what we do, both at the time of these incidents and in follow-up afterwards as well. For me, it does a lot of things. It means that a lot of team members don't leave scenes with questions. It allows people to get things off their chest, to be able to ask questions they just need to ask. But for me, debriefing has a different role at different points in time. So we do debriefing after incidents at scenes. We do debriefing in ambulance bays to actually go into a little bit more detail. And we do debriefs later on with more people that are relatives or families, or even sometimes the patients themselves further down the line. We debrief the jobs with them so they know exactly what's going on. So it's worth saying that debriefing has lots of different models that fit at lots of different points in time, but it's absolutely fundamentally important to be able to be what we like to think ourselves of, and not trying to be arrogant, but as an elite team, the only way that you can increase your performance and increase the way that we deliver the care that we deliver is by proper, strong debriefing in a safe environment with the people you work with.
Okay, I really would like to touch on a few more of those aspects a little bit later on. But the thing I'm a bit curious about at the moment is, when you do any of these debriefs, do you follow a specific structure? I mean, do you use a model or a set approach that you've designed as a team, or do you tend to use a system of just thinking on your feet?
That's a good question, actually, and all of us have different opinions on the way that this should be done. So there is no set way that it should be done, because different people want to do it in different ways. And for me, that's okay, because the end goal is often the same, but how we get to that end point is different for everyone. There is an aid memoir that takes you through the different categories of the different parts of a job or of a job cycle, and takes you through to make sure you don't miss anything that might be pertinent, that you might miss, or even, have a slight oversight of a possible learning opportunity. So those aid memoirs are good. But on the whole, if I'm brutally honest, the way that we do it is from the start to the end of a job, and we take ourselves through it. Not very in detail. We go to the detail that is relevant at each particular point in time. So we might talk about the way that we got dispatched, the way that we managed to load onto the aircraft, how safe it was to land, and the learning points associated with that. So there's all that learning before we've even made patient contact. And then we would debrief the actual clinical job itself. And for us, that's only one small part of the job cycle itself, which starts when someone picks up a 999 call and ends when we deliver a patient to hospital. So we tend to go on a chronological basis with our debriefs, but there's no set model that we use, if I'm entirely honest. And I think actually that's probably a good thing, because different people like to do it in different ways, and different people need to get different things out of it.
So just leading on from that, the next question that I have is, how do you decide who leads it then?
Yeah, so That's a really good question. And the thing that I would say about this is that some of the jobs that we go to are incredibly emotional. Some of them are harrowing. So the last few months I've been to an awful lot of murders in central London, a lot of people hit by trains, a lot of people run over by lorries, and increasingly during COVID-19, a lot of people have tried to be violent towards themselves for whatever reason, or even their loved ones. And for that reason, the people that are delivering the care right at the forefront of that patient delivery are not always the best people to deliver the debrief, in my opinion. So we do, in the London system, they have instant response officers that respond solely for this purpose, and they respond solely to support staff welfare and to run debriefs, both hot and cooler debriefs down the line. And they are the people that are trained, often trim trained. A lot of them are trained to do this initial debrief, the setup. That said, it all depends on what the job is, because if we've gone and done a very invasive surgical procedure on a patient, like open chest surgery to try and repair a hole in the heart or something like that, then actually the initial debrief sometimes just needs to be an explanation of what we've done, because a lot of the more junior people that are with us, not in our team, but around the teams, around the fire brigade, the police, the ambulance services, they just don't understand what's happened. And unless we contextualize what has happened in the last 20 minutes, they leave with a huge amount of questions, and it can be quite harrowing. So sometimes we need to step up and really talk through the job cycle itself prior to doing a more hot emotional debrief around our feelings and how we can make sure that we're safe for our next mission, our next job. So it really does depend on the type of job. And I've certainly had experiences where I've been asked to lead jobs because it's more of a medical debrief and people really want to hone the clinical stuff. I've had jobs where we've decided that actually the IRO that had more situational awareness is the right person to lead the job, because he saw the job from a wide-eyed lens rather than our narrow focus on the patients or patients we were dealing with. But then I've also had issues where we might have had differing opinions on scenes, and actually we might have a paramedic, or we might have another clinician that might not necessarily agree with the course of action we've taken. And they're the really useful times to debrief. They're the times we absolutely need to get this right. But quite often we recognise that it's better coming from a peer level. So me, as a doctor working on the streets of London, somehow, I don't like this, but somehow it puts up a bit of a hierarchical barrier that I continually try to get rid of. But sometimes offering my teammate, the paramedic that I'm working alongside, and we know each other inside out, sometimes they're the best person to deliver this debrief because it empowers the people around us to actually have honest, open conversations, rather than, and I've seen it, people not always wanting to speak up despite me trying to make them feel really comfortable. So it really does depend, and you need to have the emotional intelligence to work out who is best to deliver that at that point in time.
Okay, interesting. Just a little bit earlier on, you did talk about debriefs that include a wider group, and you've alluded to it there in terms of the team that are actually present. Do you ever run debriefs with family members, and if so, how do they come about, and who manages those?
So I think gold standard HEMS care, helicopter emergency medical service, has to involve the care of not only the patient but also the family and the other people connected to that individual. So on every single job, I seek out and I really work with the families that are there. I don't think you're necessarily talking about at the point in time, because if we were doing an intervention or we were popping a child off to sleep, I'd absolutely have the family member or parent absolutely involved, holding the patient's hand, explaining everything that we're doing, because as long as they're on side with us, it makes everything easier, and also it ultimately means the child or the patient involved gets the care that they require in a more timely and efficient manner. What I think you're meaning is actually how we involve relatives further down the line in debriefing, and I think we do that, and the organisation I've just worked with have a very good patient liaison team that follow up all of our patients, and all of our patients that die, unfortunately, on the streets of London do get personal follow-ups, and they all get follow-ups from our patient liaison team, and they get given the opportunity to meet us, and they get opportunity to ask questions and for us to do another debrief. And for some of us, that's quite difficult because we end up redoing some of these jobs again and again and again. But I've now understand how absolutely powerful it is for these families, and I've unfortunately due to COVID, haven't always been able to meet families face to face, but having the opportunity and the absolute privilege to meet some families on Zoom and to talk about their experiences and to understand the background to some of these individuals and what's happened to them and the lives that they were leading is a privilege for me to hear. But also it's really important as part of the grieving process of those families to understand what happened on that night. What did we know? And the fact that I can reassure them that we did everything that we could possibly have done for that patient, even though we weren't in a hospital. People don't understand that we take the hospital to the patient so they get the care a lot quicker than they would have done. And they need to know that, because otherwise they don't understand why we were on scene for so long. And they need to know that actually, you know, they weren't alone at the end of their life. Sometimes they need to know that actually sometimes the most powerful thing that I can do or our team can do is put a blanket under someone's head so they're not on the cold concrete, or cover them up with a blanket or something like that. And those things are unbelievably important for families to know, and that's why they should ultimately be involved in the debriefs further down the line. And it is really important, and it's not all sad, it's not all gloom, like I've just talked to, briefly around a death case, but there are patients that we go and meet and we see in hospitals, and they have questions because quite often they don't know what's happened to them. They don't know what we did to try and help, or to ultimately help them save their life or whatever. And they have a right to know what's happened. And they also, some of them don't want to know straight away, but most of them come back a few weeks later wanting to know every single detail about what we did, because they really want to know. And it's really important for their adjustment process to the new start of their life, and to be able to start that chapter.
And based on doing that, what do you have any understanding of what it actually does to them? Obviously they come back and you said that, and that they want to know every detail, but what do you think it gives them at the end of the day?
I think it fills in. When I speak to a number of patients, they have this period of time where they don't remember, and then they remember waking up on an intensive care unit. Most of them don't remember the incident, the accident, or whatever the incident was. They don't remember that. Some of them do sort of remember the preamble up to it, and some people do remember part of the job, but the vast majority don't. And they require that period of time to be filled in, because they want to know what has happened, because it's such a disorientating and emotional and difficult time for them to try and process 2 weeks of their life that they haven't got. And they don't even know what happened to them to understand why they're lying in this bed on the ventilator with all these lines, etc. around. And it's important for them to put closure on that little part. And it's not closure forever, because some of these are some life-changing injuries that they will live with forever. Not always, but sometimes. And they also need to be given the opportunity to do it at their own pace. So some patients want to know stuff really quickly, and they want to ask us lots of invasive questions about how we did stuff, down to the point of, why is there a scar here? What did you put under my clavicle? That was a subclavian line. They want to know all that sort of detail. But some people don't want to know that. So you need to have, during these debriefs, you need to have the emotional intelligence or the situational ability to be able to understand what they do and don't want to know. And you need to let them really drive that debrief. So there's no point going into this debrief with a patient or the family with a model. There's no point going in with a list of things that you want to convey, because it really is a conversation that has to be led by them, because everyone wants to get slightly different things out of it. And we don't want to push them. We don't want to make them upset. We will, because unfortunately going through some of the stuff will be upsetting for them and for us. But we have to let them lead that, and they have to be the person leading that debrief.
Gosh, just, you talked a lot about upsetting, and it's going to be upsetting anyway, and likewise as for the team when they see very distressing things. So one of the questions that I wanted to ask you was about psychological safety of people who are, and if we go back, let's rein it back into the team that you're debriefing on a regular basis or being debriefed with. Are there any strategies that are used to protect the psychological safety of the team when a debrief is taking place?
Yeah, so it's worth, well, for me, it's all around culture. But let's just give a little bit more context to that. So the debriefs that we do with the teams, with the ambulance services and the police and the fire crews tend to be just about afterwards. And that's really to answer any questions and to make sure no one leaves with questions and they're not going to be able to sleep at night that night. But then what goes on after that is when we leave those people, we have a much more thorough and a much more in-depth internal debrief just with our team, the air ambulance team. And that is when we are safe. And that is when we are with the people that we know. And that is when we've been all working and brought up in a culture that is open, and I mean totally open. So I'm talking about, I'm quite happy to stand up in a room of 20 or 30 colleagues and say that I got something wrong and I made a mistake, because I know that the information and people in that room will just be trying to drive the learning out of that situation to feed it back into the system so we can share that idea amongst our team to allow us to innovate, to allow us to improve. But that has to be done in a safe space, and you have to have absolute trust in the culture and the system you work in. If you work in a system where there is a blame culture or a culture where fingers get pointed, then the learning is stifled in that organization. And not just that, it means that teams might have learning in their little micro teams, but that micro team will never have the courage to share amongst all the other wider teams. And that's really important, because the system that I worked in did allow that. And we were allowed to be an open and honest, and we have a very open reporting culture. So if things go wrong, we report it openly on a reporting system and everyone knows about it. And that's really important, because that allows us to be honest, open, and ultimately safe, psychologically safe is what you're saying. But there's also personal psychological safety as well, with respect to sometimes we don't always want to talk about things. Sometimes, you go to jobs that might remind you of your loved ones or previous jobs. And actually that's also okay. If people give you the nod, or we've all got little ways of going a little bit quiet or doing certain things, we know that actually, let's have a cup of tea before we have a chat about this, because actually we just need 10 minutes. And that's okay to say that. And as you work with people more and more and more, you understand what their triggers are. So for instance, people that work with me all the time know that on scene, I'm incredibly verbal and I will talk about everything. I will have shared decision making. My process will be out loud. My model will be absolutely shared with everyone around me. But if I was to go quiet, people know that something's not right here. And the hand literally, I've had it a few times, where the hand literally comes onto my shoulder from my colleague, my paramedic, and they're like, dude, you're right, you're not behaving normally, because that's how well we know each other. And that translates through into when you can debrief and how safe it is for you personally, and in the people around you, how safe you feel. But ultimately, you've got to have that culture in an organization if you want to be a high performing organization.
Rob, thank you so much. That's such a valuable insight into your world of debriefing, and particularly in pre-hospital care. And I think there's been some incredibly valuable messaging coming out there. And for me, the most valuable one is this honesty and this openness in a safe place. Because if we are going to learn from situations and feel comfortable to do that, we've got to create that kind of culture. So thank you so much for joining me this morning. And I look forward to catching up again with you soon. Thanks very much.
Cheers.
Thanks.
Thank you. Bye-bye.
Bye-bye.